Hi everyone, lots coming in now and joining the session. Great that you've been able to join us for this lunch and learn session about some new direct payment resources that we've developed. We'll start in a minute, but just bear with as people come from other meetings and get into the session. We'll just give it a 1 minute if that's okay. If you want want to be familiarizing yourself with the functions. You will be able to use the chat function, but we will very much be focusing on asking you to use the question and answer function to as we go through the and highlight what we've developed for you. We want you to ask questions about them and about issues that they might raise for you. So I think we'll get going if that's okay with everybody. It is being recorded to watch back. It is indeed. We'll be sharing the link after the session, probably tomorrow. And there's lots of people who wanted to join the session who haven't been able to because we hit the maximum number. So we'll be sharing the link with those people too. Okay. So just to let you know, we won't have interaction with the microphone today. So it's a panel discussion, and we'll be highlighting what the resources are for people. Just to let you know, that function won't be available for participants, or only panel members. Okay, thanks. Right. So, can we go to the next slide, please? So, it's lovely to that you've all been able to join us this afternoon for this lunch and learn webinar session. My name's Martin Walker from Think Local Act Personal. Could we have the next slide, please? Just to let you know who TLAP are, there you go. We're a partnership of people and organisations working to make health and social care work in a more personalised way, so that people can live their lives their way. I'm going to introduce panel members, if that's okay. So that's me from TLAP. This work has been very much a partnership of three organisations, ourselves, and that includes the National Co-production Advisory Group, um, the Southwest Direct Payments Network, which is also facilitated by the Independent Living Group. So it's great to have people from all those organisations here. Tim, would you like to introduce yourself?
Hello, I'm Tim Thornton. I'm from Bristol City Council, and I'm going to do a bit more of a talk later on.
Thanks very much, Tim. And Tim, you chair that network, don't you? The Southwest Direct Payments Network. Thanks. Bernie?
Hi everyone, Bernie Howard. I'm a Senior Commissioning Officer for Somerset Council. Been a member of the Southwest Network with Tim and co for quite some time now. Happy to be here.
Super, thank you, Bernie. Rachel?
Lovely. Good afternoon, everyone. I'm Rachel Mason. I'm a family carer of two adult sons with autism and learning disabilities, and I've been managing their direct payment for about 17 years now. And I'm part of NCAG, the National Co-production Advisory Group linked to TLAP.
Thank you, Rachel. And David from ILG.
Thanks, Martin. Yeah, I'm here from Independent Living Group, and I've been co-chairing the Southwest DP network with Tim for about 5 or 6 years now.
Super, thank you. So just a reminder, please do use the question and answers function on the bottom ribbon, and ask away your questions. You'll hear about what we've done, why we've done what we've done together, and the resources and how they've been developed, and some of our thoughts about how they can help both you as practitioners and in your work supporting people. to be able to live a good life with a direct payment. We know, though, in the discussions we've had around developing these resources, which are very much, I think we see as a foundational resource, it's challenging to work in the environment that you're currently working in. We do know that, and we recognise that, and I think we see these resources as kind of being step one on a journey of working with and supporting you as practitioners in the work that you do. So we want to know what. Whilst that's great, this is good basic information and key information. The kinds of challenges and issues they throw up for you as practitioners, all finding flexibility, flexible use of direct payments, all fine and dandy, but actually that's not straightforward for us as practitioners. So we want to know what those issues are and get your questions about those and see if we can think about how we might be able to respond, maybe in further series of webinars. So do ask your questions. I'm going to pass over now to Tim to help us set the scene and why we went about creating the resources in the way we did.
Thank you very much, Martin. And I'm going to start with a big thank you. So thank you for giving us the opportunity to be part of this lunch and learn session today. The network really do appreciate it, and I'm sure the rest of the colleagues that are working on these resources, very gratitude to both yourselves and to Adam and everyone else who's supported in making this happen. So that was my big thank you. Okay, I didn't really say a lot about in the introduction about myself because I knew I was going to talk this bit now. And I just wanted to say, in my past, I've been supported by social workers, and in my profession, I'm a social worker. And I'm from that experience of both having a social worker and as I'm visually impaired and I lost my sight when I was 23, I soon found out how important it is for a practitioner or social worker to be informed and have the right information to be able to give an individual their chance and their choice and control of how they live their lives and moving forward in moving the right direction. I particularly had a negative experience with my particular social worker lacking the right information, but it's been embedded in my practice through my 25 years of being in the profession now, of knowing how important it is to have the right information, the correct information, to be able to empower the people to be able to have that choice and control. So I've embedded that in terms of my own part of the work I do now. Is I'm the Bristol Direct Payment Practice Lead. I'm in Workforce Development for Bristol City Council. And since the pandemic, or even prior to the pandemic, there was quite a challenge for me in terms of what was happening in terms of practice for social workers and social care practitioners within Bristol, about the lack of confidence that practitioners were having in being able to have those open conversations with citizens at that support planning stage. So I was starting to wonder about how could I be able to start looking at how we could build that confidence in terms of knowledge. And something that came from was the TLAC report, that was a Better Direct Payments, that Insight to Action report that I really thought was actually quite thought-provoking for me, because I could reflect on what a lot of those key points that they were doing throughout that document and that report, and the research that Martin and others had actually collated throughout that, was able to look at how could I then use that as a platform to be able to look at building my program and redesign in order to start looking at practitioners having those conversations again. I pulled out just three. I know there was more than that, but the ones I sort of started to focus on was about building better information and guidance. That was absolutely crucial. About developing a training program that actually meant that actually incorporated all professions in terms of occupational therapy, right through to social workers, team managers, etc., so that actually we could look at the whole spectrum of training, and also to look at, going to refer to my notes now, in terms of looking at how we could develop a better practice throughout with the training program. So what do we do? Is the next slide now? Still on slide one. Okay. The main points I focused on was actually looking at how could I create a single point of access. So that's one of the things I did. Is the main thing was to redesign our single point of access for all practitioners to know that that was a great way to signpost and to find out all information. So that was one of my key elements. I created a new training program so that all practitioners could actually regularly about refreshing. I developed an e-learning refresher program as well. So it's an introduction to any people coming on induction. They could do the e-learning as well as going to do a refresher. It was quite a key element there. So again, following through into that TLAP report. I also developed some videos as well, which was working alongside personal budgets and direct payments, which we also got translated into Somali translation. It's one of the key kind of communities that are using direct payments a lot within the city of Bristol. So really key to get that communication across to that community. Was also creating a support hub for direct payments, particularly to do that bit of hand-holding for practice. I thought it was really crucial. We did it as a pilot and we're now going to embed it into our formal practice. This was about literally basically doing that physical, almost hand-holding, handing over cases where the direct payment was specific to a small specialised team in order to help practice and practitioners feel confident that they've got this kind of process to follow through. So it was about simplifying the process. Going back to that TLAP report that identified that simplifying processes was absolutely crucial in unlocking the door for a lot of practice. But still, the thing that angst me was still about this building confidence. Although I'm doing lots of training and everything else, there still seems to be an unblock, which was quite fascinating for me, thinking, well, what's happening here? So is it going on to slide 2 now, which is about the South West Network?
Yeah.
So the network. So as one of the co-founders of the South West Networks, we just mentioned, obviously thanks to Martin's recognition of the network. We founded this 5 years ago and we've grown ever since then. That was in 2020. We've got over 20 local authorities and NHS members as part of that group. And we have it's a really great opportunity not only to share information, but sharing good practice, but also what we have learned is that we can then work alongside ILG and also working with TLAP and obviously latterly with Rachel and her advisory group. So one of the things we recognised following the work that I've been doing was actually when we were talking and engaging through our network, that we were finding that we had common themes. We were all finding that we were all at that same point in our process of looking at not only was there a lack of confidence, but also we were all looking at what training resources we had. And we were all seemed to be mirroring or also trying to find a way through it and trying to struggle through this. And it was in those kind of discussions, and Martin very thankfully came to join our network as a really good contributor to that network, that we were then starting to recognise that how could we turn that around? What could we actually do to make some difference here as 20 local authorities and professionals all in the same group, that we could actually try and make a difference by looking at resources that could actually not only be used in the network, but also possibly to be used more nationally. So that was where we started working. Obviously, we then started to look at building about how we could do as a small group of in that co-production and partnership working. We obviously got together with ILG, as Martin has said, with TLAP, Accels, and some key members of the network came together. And over months, we've been developing these essential resources, which will obviously be really beneficial to all local authorities and people doing any training program, which will be able to be accessing this to create and simplify the process, as well as obviously we will be able to look at stop duplication. Obviously, standardization comes across it, as well as obviously there's always an element of lack of well, not using resources, financial resources, time over each time with each local authority producing these resources. We've found it could be, again, it comes back to that single point of access where we can modify that and develop those resources further. I don't know if, and like I say, I just want to say thank you to everyone that's put this work in, and hopefully we can now progress further with this development, and hope everybody finds it extremely useful. Thank you.
Thanks very much, Tim. And so that set the scene and the why of we went about creating these resources together. And just to say to Tim, outside in terms of Think Local Act Personal, and I'm sure Rachel will say shortly when she comes in, you know, in terms of the experiences people in the National Co-production Advisory Group has, we absolutely hear the same sorts of things across the country, not just so it's not just happening in the Southwest. You know, that whole how do we support practitioners to build their confidence. So we're going to get into now what the detail of what's on offer, and so the resources are live on the website. So some of you may have already seen them, but we'll just walk through the content if that's okay. So for each module that we've developed, there are 7 modules, and for each module there's a video which is around 8 to 10 minutes long. We tried to make them bite-sized, so we've tried to make these resources bite-sized. So and you can jump on, and if you just want to refresh your knowledge about one particular topic, you can do. Or if you wanted to have a focused discussion as a group of practitioners, you can do. Just jump onto one module. And so for each one, there's a video, which and it took us a fair while, I have to say, between us, a labour of love, developing a script, making sure we were all agreed about what we could say about that topic together, what we should say about that topic. And then there's just a few questions. I think there's no more than 5 questions, quick questions. They're just about checking knowledge, reinforcing learning, having watched the video, dead straightforward quiz, just to reinforce learning. And then we developed some discussion questions for each topic. And we're hoping you might, well, I didn't talk to get that into that because Rachel and Bernie are going to talk about how they're going to potentially you could use those, but some discussion questions to pique your interest around that reflective practice type approach that we know that practitioners love as part of the work you do. So appealing to that reflective practice kind of approach. And then we put some links on in terms of some related resources to that topic. Might be a video about, related to that topic, might be a link to the statutory guidance or a leaflet or a handout that we've gathered from some of the councils involved that seem to us to be helpful tools that you might want to borrow with pride. Okay, so let's go on. So let's have a look at what the modules are. These are the 7 modules we've developed. We were very much supported by our colleague who is supporting us today, Adam Milenisic, to help us actually sort of really clearly think about the audience and the audience here for these resources is very much practitioners, whilst they'll be available to anybody and they might be helpful to other people working in social care. It's very much about supporting practitioners, as Tim said. And these are Adam helped us work out, well, this would be a good flow of subjects. It took us a fair bit of time and work together, I have to say. So these are the 7 topics. What are direct payments? How do they support choice and control? We very much set the tone there. We go back to self-directed support, principles of self-directed support and independent living. It's something that we think is kind of a little bit forgotten and lost in terms of the reasons why the choice and control agenda developed. So we set that scene for the rest of the videos. 5 key principles in the second video: being outcome focused, enabling creativity, flexible use of direct payments, clear information and understanding, and appropriate budgeting. And we start to explore some of those topics. In the third one, what can and cannot be funded with direct payments. Now that very much is a high level, and it gives you very much a sort of a sense of pretty much anything, if it's legal, should be possible, so long as it's aligned to your care and support plan kind of principle, because we know there's lots of local flavours go on there. So we wanted to produce something that'd be useful for you at that point, without getting into too much detail. So we cover the key bits of that. Literally a walk through the process elements in 4, and then a real focus back on outcomes and that focus on outcomes and how that helps enable creativity and flexible use in 5. Reviews, we know that's a key point, and people that can be a really unnerving experience for people, that reviewing direct payments. And also there's that sense of, what do we need to make sure you as practitioners communicate with people in terms of looking at reviews and how things are going, and the things that you need to remember to sort of talk about. And in 7, about the responsibilities of direct payment recipients, the things we together think you ought to be thinking about and have in your minds, and making sure people are clear about in terms of responsibilities when they take on a direct payment. So that's the 7. I think we're just going to have a little look at, I think that's the next thing. We're going to take a little look at one of the videos, just a minute or so's snapshot. Oh, sorry. Just to take you through the screen, if you've not looked at the resources yet, this is how things are set out. So, clear, a bit of an introduction about what that particular video. This is the navigation screen to all the modules. So this is the landing screen, and these are the 7 modules here. You just need to click a link to go to each module. We're going to nip to 5. And this is for each module. They all look the same in terms of the layout, an introduction to the module, the video presented there, and you can actually get to them loaded up on YouTube. There's a little test your knowledge, just five or so questions, dead straightforward to use, and then the discussion questions to prompt your thinking and reflection. And then links to resources. So they all look like that, fairly straightforward. We're going to have a quick look for a minute to 2 minutes of this particular video to give you a flavour, and just to let you know, you might want to crank your sound up on your PC at this point. We have tested it. This is as loud as we can get it. For some reason on the Zoom call, they play nice and loud when you're actually watching them off the website. Off we go.
Direct payments are most effective when they are tied to clear, person-centered outcomes. Here's why. An outcome-based approach gives people flexibility in deciding how to spend their direct payments. They ensure care and support is tailored to the individual's goals. They help you, as a practitioner, measure whether the support is making a difference. Co-producing outcomes with people. Co-producing outcomes means working collaboratively with the person to identify what matters most to them. Here are some steps to guide the process. 1. Start with a conversation. Ask open-ended questions, such as, what does a good day look like to you? What's important to you in your life right now? 2. Explore their goals. Encourage the person to think about what they want to achieve, not just what services they might need. 3. Prioritize together. Focus on a few key outcomes that are realistic and meaningful to the person. 4. Record outcomes clearly. Write outcomes in simple, person-centered language in the care and support plan. For example, instead of attend a fitness class twice a week, write feel fitter and healthier.
Great, thank you. Thank you, Adam. So that gives you a sense of what the resources look like, what they are. That was just a flavour, sort of 2 minutes of a 8 to 9 minute video of a series of 7. So it's quite a lot to go at there. I'm really pleased that Rachel's been able to join us, and that was Rachel was able to work with us from the outset on this project. Rachel, could you tell us about how you think this might help practitioners in working with people to help people get a good life, and then draw us into talking to Bernie, talking about how you see the resources could be used by practitioners.
Brilliant. Brilliant. Thank you. Well, I mean, a bit of background for me. I've been the nominated person for my 2 sons' direct payments for about 17 years now. And I've worked in the self-directed support arena for about 15 of those. And I've supported many councils over the years with their ISF or their direct payment offers. Now, if you were to ask anybody who draws on care and support, be that an older person, a person with learning disabilities, a person with physical disabilities, mental health, who draw on care and support, they would say, when I get up in the morning, I want to live a life, not a service. But often commissioned services that are put in place for us to meet our eligible needs don't have that flexibility to allow us to live our lives in the way that we choose. Direct payments can offer that freedom, but we still seem to lack the promotion of them to people who are new to services, people who are stuck on long waiting lists, those people like my sons who are perhaps in current services that just aren't working for them. Now, I don't know if that lack of confidence, is it a lack of knowledge, or is it a lack of trust in direct payments? But hopefully these co-produced resources will provide a strong foundation on which to build that confidence. Now, these resources are aimed at practitioners, and because they've been co-produced, they cover everything that people who draw on care and support want their social workers to know, to have the confidence to relay that information and those choices to them and to act upon. Now, the language and the images used, the questions asked, the narrative to the videos have all been designed to be clear and factual, as factual as possible, overseen by the project group that brings together lots of different perspectives. So you've got a social worker perspective, you've got direct payment support, commissioners, person with lived experience coming from myself, and each of us thoroughly and meticulously went through repeatedly the videos, the narratives and the quizzes to ensure that it reflected the different perspectives and the different points of view. Now, as many of you may know, I asked for a direct payment. It wasn't something that was necessarily offered at that point. My son was already in that residential setting. But being able to ask for a direct payment liberated my son from the specialist residential services that weren't working for him. And he now lives in a place that he calls home and lives the life that he chooses, with now a collaborative, trusting relationship with our local authority. And underlying that, as you will see within the videos, a care plan that has been co-produced with the outcomes, and then an attitude of over to you to be able to use creatively that direct payment to purchase assistive technology, adult learning courses, all the different creative things, as long as it's working towards those outcomes. And we have got, or I certainly have got, a good relationship with my local authority and with Bernie. And Bernie, I'm going to draw you in at this point. What do you think? What are your thoughts on how these resources could increase the confidence of practitioners and the use and uptake of direct payments?
Thanks, Rachel. Yeah, I mean, as many people who know me, I've been around for a while in many different groups and guises. like Tim and like a lot of authorities, anyone that's in the field of direct payments, we try and do our own videos, our own training, documentation for our own workforce. And sometimes they can be a bit lengthy, they can be a bit wordy. What we're really proud of with these resources is they are bite-sized. So we all know our practitioners, they've all got massive caseloads, they're all really, really busy, and capacity is an issue right throughout England, really. But everyone should be able to spend the 5 to 8, 10 minutes that each video is. The questions that come along with these resources, they'll be invaluable for team managers or advanced practitioners to sit down with smaller groups and have group discussions, which I think will be more intimate and more beneficial for each of the teams. And hopefully develop some sort of DP champions within each of our social care areas. We have neighbourhood teams in Somerset, across Taunton, Sedgemoor, Mendip and South Somerset. So we're hoping that these bite-sized resources will go through each of the teams in their own local areas. I'm happy to go and float around Somerset to sort of promote them and talk about them, but it's mainly to give this confidence back to the workforce so that they in turn can train the new staff coming through. But best of all, if we share these across all of our counties, we're saying the same thing. So there's more consistency that's being talked about in the realms of direct payments across England, really.
Absolutely, thank you. Tim, I don't know if you have any other thoughts on the implementation of the resources.
Sorry, I was on mute. Sorry, Rachel. Yeah, thanks for coming back to me. Yeah, as obviously it's the lead officer for workforce development in terms of direct payments, it's definitely going to be one of the key resources for me to be using alongside, I can be as part of that main sort of program for practitioners. But it's you can't be training staff on a daily basis. It needs to be where I say it will be added into that toolkit for all practitioners to be able to go there as a resource for as and when they need to. And because we've created the 7 resource videos, it means they can go to and target the one that they're particularly working on at that moment in time to either do it as a refresher or to actually improve and develop their knowledge base around offering direct payments. So I'm using this as part of that toolkit in order to build that practical confidence so that we can start turning the page for a new chapter in improving the uptake of direct payments, because we're all recognised across, particularly in the network, and I'm sure it's reflected in other local authorities across England and Wales, that obviously that direct payments aren't on the increase as they were many years ago, and we need to reverse that. And so there's some more work we're going to be doing within the network and hopefully with Martin and his colleagues to looking at how we can start bringing and highlighting direct payments further on the agenda, really, because I think we need to really improve our delivery and service to citizens, really, to give them the choice and control that they deserve over the care and support. Okay, thanks, Rachel.
Lovely. And I was just going to interject and ask whether or not, David, had you got any thoughts of the increased confidence of direct payments for people that want to go down employing a PA route?
Yeah, thanks, Rachel. I think these resources are a great start. I think they provide a really good, solid baseline for practitioners and something we can point to, so there's some consistency in approach, which I think is desperately needed. We've seen it in the network. And I think if you get that baseline right and the foundation's good, then it leads into conversations around how people want to use their direct payments. If they want to use them to employ personal assistants, one thing we were keen to ensure was recognised in the resources was, a nod to the amount of support people need. That it needs to be resourced properly. That there should be good direct payment support services available, and those services can then support the direct payment recipient, but also practitioners can lean into that support. So we were quite keen. We had quite a lot of conversations around how we how we reflect that, given that the national picture is so varied. But I think we've done a really good job of that, and I think that's credit to TLAP, IOG, and the network for collaborating in the way that it did to try and ensure that message came through.
Lovely, thank you. Back to you, Martin.
Super, thank you, Rachel. Thank you very much. So we're going to get to questions now. So we've got some questions that have come in through the questions and answers. So I'll just I'll read. I think we've got half an hour, so we can cover most of the questions, I think, if that's okay. And there's a good range, I think, in terms of detail and broad sort of, and then maybe sort of more straightforward stuff. So Alan asked the first question: do the resources cover the role of local deaf and disabled people's organisations in advancing direct payments and the role of peer support? David, I wondered if you wanted to respond to that one in terms of do the resources cover? Yeah, what do you think about that one?
That's a good question. Well, yeah, as I just said, really, we tried to ensure that the resources pointed to the need for well-resourced support, information, and advice for direct payment recipients, and we did that, and it does do that, and it does that particularly. We steered clear of suggesting where precisely that support should sit, because I feel like that's maybe the next phase of the question. That's something we all discussed at length while we were putting these resources together. But as I said, because I think there is such a there is such variety currently, we felt that actually establishing the need for that info, advice, and guidance and support to be resourced properly was the first step. And I think the resources that we've created do that very, very well. And it then leads into the question of, is that support best placed in local organisations, disabled people's organisations? And I think we all felt that it probably is, and that there's a conversation to be had about that, and establishing that trust between local users-led organisations and local authorities. But I felt like the resources, and we did discuss this at length, didn't we, Martin? Because it was certainly something I kind of was a bit of a broken record on. But yeah, so I think it does that. I think it sets the scene for that conversation, Anne, really, really well, I hope.
Yeah, very much a sense of, as practitioners, we're not expecting you to know everything. Absolutely lean into where it's available, because we recognise it's not available everywhere. Where it's available, lean into good direct payment support. And that might be an internal team, and it might be a local disabled people's organisation. Not every practice has got a local disabled people's organisation. That's something we came across when we were doing the research for better direct payments that Tim mentioned. Great, thanks. So next question. I wonder, Rachel, if you might want to pick this up. I mean, but and we just in terms of responding to the question, we don't have to give it a perfect answer, but sex and loving relationships with reproductive rights for people with learning disabilities are often ignored by social workers and assessments. Are the resources available going to cover any of these topics?
Wow, okay. The resources that we've got at the moment, I would say, are generic and to support the basics and foundations of people living a really, really good life. And it depends to me of whether or not there are clear outcomes within an individual's care plan around building those more intimate relationships and the support that goes with that, and how that direct payment can be spent to support that. I'm a little bit vague on whether or not it's resources to support the knowledge of that, or actually are we talking about being able to spend a direct payment on supporting somebody having an intimate relationship. And again, Bernie, I'm going to throw it across to you, because it's interesting that if the outcome is written within the care plan and it is a clear, important part of someone's life goal and is important to them, that the direct payment should be able to support an individual's choices.
Yeah, I thought it was a fantastic question, actually. And I totally, being transparent, hold my hand up, never even crossed my mind, if I'm totally honest, as a commissioner. But I'd be more than happy to sit down with Martin, TLAP, Adam and the rest of the group, to say maybe, you know, we've when we were developing these resources, we were talking about, as Martin eloquently put it, the pithy topics, where we could really deep dive into some of the areas and do something more bespoke. This absolutely could be something along those lines.
Yeah.
But you're quite right, Rachel, in that thinking about producing something, are we producing it in terms of education for people on how DPs can be spent to meet outcomes, or are we going to be educating our workforces in how to have the conversation initially with the families
Absolutely.
or with the individual? But brilliant question, and
Yeah.
one that I'm happy to carry on further with the group.
Yeah, super. I think that's the entirely, Bernie. Yeah, we want to know what those pithy issues are, don't we?
Yeah.
And how we can you know, use these as a base foundation to build other supportive resources for you. My council can be quite risk averse when it comes to direct payments. How can I help to change that? We did talk about that too. I wonder, Tim, what do you think about that?
Again, I think it's, if we're going to talk about the resources, it's almost like, well, I get to almost go down to ground level, almost back to real basics in getting practitioners even to have a knowledge of direct payments. And it's something that comes all the time about looking at what practitioners say about obviously offering a direct payment, and about how that risk comes into that because it's unregulated care. But I think what we were looking at as the network, not only the network, also working with you, Tina, and with Rachel, was actually saying, well, what does good look like in terms of how can we measure better outcomes for people in terms of, and that's where you're going to start building confidence for local authorities. Well, there's always a financial conversation to be had, as well as actually saying, how can you improve people's lives? How can we better outcome for somebody than it is with a very much a care agency, which is time restrictive and time controlled, and obviously you have a rotation or revolving door of carers, rather than demonstrating really good, what good can really look like for somebody in living their lives to their best, and being able to have that opportunity to have who they want the care to be provided by, you know, by who and when. And I think that's where I'm using it at the moment within our, you know, within Bristol City Council, is looking at where you can get really good examples of it and use more of those, because it's often the negative conversations I'm having, and I'm reversing that by actually demonstrating really good positive outcomes for people, and using those positive stories can be a really good vehicle to actually to go back to within your internal systems to be saying is actually, let's start looking at those kind of really positive stories.
Thanks, Tim. I think probably along the same lines, Phil's sort of made a comment stroke question. He's curious to hear about the main pushbacks people experience from social workers and residents when it comes to uptake on DPs as an alternative to standard packages of care. So, you know, in terms of what are the pushbacks that we tend to hear about, you know, why do people take up packages of care rather than a DP? I mean, that's a big question actually, but anybody got any? It's the kind of things you were talking about, I think, Tim. But anybody, Bernie?
I can jump on, don't mind.
Yeah.
We probably haven't got time to discuss that question in depth, if I'm totally honest. There are many reasons why there's pushbacks. Finance being one of them. We can't ignore the elephant in the room. All local authorities and ICBs have got a financial crisis at the moment. So finance does come into it. However, you know, the Care Act's quite clear in that it should be outcome focused. So I think a lot of the pushbacks from people are the burden, the responsibilities placed on them for running a DP. What does it look like in their daily lives? Have they got time for that? I hear a lot of people would like the choice and control, but they don't want everything else that comes along with it. So as a commissioner myself, I try and think, how can we make this less burdensome for people? So that seems to be a pushback from residents' perspective. It's literally the responsibility that's placed on their shoulders. how difficult it is to be an employer when you've never been an employer before. What does that look like? Again, it comes under the responsibilities hat. And as David points out, if you haven't got a good advice and guidance service or a support service helping you alongside your local authority, it can be really scary. It can be very scary to be an employer if you've never been an employer before. So that's one of the reasons for pushbacks. From staff across Somerset, it literally is lack of confidence in how to talk about direct payments, how they can be used positively, correctly, the do's and the don'ts. So this probably could be a question for a session all on its own. But yeah, there are many reasons as why there are pushbacks and uptake can be slower.
And I think you've covered a question we got from Maxine, which was in her practice finding most don't want a direct payment, often come back to change back to LA funding, maybe because it's an extra job for people, they don't understand it. It's something about that, clarity about that burdensomeness, and that's definitely stuff we want to work on and are trying to work on in terms of other things you can do to simplify processes and make it as
absolutely. Martin, if I may, certainly from my own lived experience point of view, there are two things. One is when a care plan is written in time and task, if you like, if it's written and very prescriptive and it doesn't give you the flexibility to be able to be creative with a plan, it can actually tie your hands. And if it's not achieving what you want it to do, so if you've come out of a commission service into a direct payment that's as prescriptive, you'll end up going back again because you're doing a lot of work for actually no more gains. You also find that there's often a build-up in somebody's direct payment where there isn't a marketplace or there isn't anything to buy. It's very difficult perhaps to recruit a PA or the knowledge even to be able to take an outcome, because that takes skill, to have an outcome within a care plan and know how to break that down into steps. So this is the outcome. So how do I get to that outcome? And being able to have the resources, person-centered planning resources, perhaps, to be able to understand how to get to that goal and how to use the direct payment. It could be to buy a piece of tech. It could be to buy an adult learning course to gain the numeracy skills that they need to achieve the goal of being able to do their own shopping and so on and so forth. But that in itself, if you haven't got the right direct payment support service that goes beyond PAYE, the employment side of things, and helps you with the brokerage, helps you with the what's out there in the community to do, and how does that link to gaining experiences and working towards my outcomes. That doesn't often come naturally to people, and I think that needs to be built in to more direct payment support service contracts.
Super. Thank you. We've got a question from Anne. My concern with DP's direct payments is that they do not mirror the costs of care. So I have always thought this was not an equal service. Clients are constantly topping up, and this shortfall is not affordable for all, therefore excluding choice for some. Any reflections from the panel? David or Tim, this kind of it goes back to some of the work and the great stuff that's happening in the network. And just to let you know, because I think the network is actively sort of exploring this sort of thing, and current survey out in terms of what happens for DP rates and things. I know we want to. I just wonder if Tim or David want to come in first, Rachel, if that's okay, to just sort of highlight what's your thinking about that? And what are we trying to sort of do to sort of understand the situation? Either of you, Tim?
Sure. Mike. Okay, thanks for that. It's a real difficult one, isn't it? Because I can't disagree with the person asking the question in some ways. Obviously, we work across the whole of the network. Obviously, it's supposed to be southwest, but we're going right into some of the boroughs of London now. So, and each one of those local authorities will have to reflect in terms of their demographics as well as their are they rural, are they city-based, what's employment rights and responsibilities, or what's their rate of pay? I'm obviously from Bristol, and our rates of pay obviously have to be quite competitive. So there's always a challenge in terms of trying to reflect our particular direct payment rates. We try and well, this year we've been successful again in Bristol in trying to support the revenue wage rather than just the minimum wage. So we are trying to be, and we recognise that we need to really to support the PA market within Bristol to try and have a competitive rate against lots of obviously organisations and big companies, which obviously rates of pay can often be very competitive in our city. So we do, if we want to give somebody the best opportunity possible, we need to fund it to reflect the current marketplace. And I know Bernie and others within the network will obviously be having to look at what is their rates of pay to be competitive, to try and make sure that we can open those doors, as we said earlier on, to make sure that most people's personal budgets are able to be flexible and support the market, the employment market, so they can recruit, because it would be pointless if we were undermining that marketplace by not providing the right rate. So there is still a debate, there's still a conversation happening in what are obviously financial difficult times for us all. So I think I'm just welcoming that we are now having this conversation that we weren't. I mean, in my sort of history of working in direct payments, I'm really refreshed to think that we are now having a conversation and that we are doing more joint thinking. And again, we're engaging now with members of central government again. So following that conference that we had in October last year in November, we've got them actually to come and attend. And I think that was quite a big step forward for us in the network. So hopefully we can start moving into the direction of having more complex conversations as following the question that we had about rates of pay, how they can be funded, and that flexibility and choice of control can be more embedded. I don't know, David, you've got anything further to add?
Yeah, thanks, Tim. I just briefly, I think the work we've done in the network over the last few years, looking at rates, direct payment rates from local authorities and ICBs, it's clear, as Martin alluded to, that there is a shift, which is positive, I think, away from set rates, more towards what I think the Care Act would support, which is a kind of more of a kind of budget, work out what you need and actually make sure it's sufficient based on local market conditions. I think artificially direct payment rates traditionally have been kept very low in answer to the question, and that has, as I say, it's created a market. PAs being paid a lot less. There's a sense, I think, from within some local authorities that direct payments are a saving first, and I feel like there's a move away from that. They don't necessarily have to be a saving. They can be about better outcomes and better ways of managing your care and support. And I feel like the network is moving in that direction. But they are, the conversations we have at the network are grounded in reality, and the reality is, as Bernie mentioned earlier, is that resources are tight. So it is a constant tension between wanting to provide people with adequate budgets, but recognizing that the cost per hour, if to break it down in such a way, is arguably cheaper for direct payments than it is for commission care. So that tension isn't resolved by these resources or that network alone, but we are working at it and chipping away at it. And there's certainly good people in the network who are quite keen to establish parity between direct payment budgets and commission care.
Thanks, Dave. Did you want to say anything, Rachel? We're running a bit short on time, but please do. Do you want to?
It was just a brief example, if you like, for my father, and the Care Act is quite clear, as David and Tim were pointing out, that the budget that you give has to be adequate to meet need. And my father opted out of a dom care service through lack of capacity, and he was looking for different micros in the area, and there wasn't any capacity, and the only ones that were available were slightly higher than the direct payment rate that was offered. I gave the social worker evidence enough that I had gone to every different service agency as well as micros, and showed that they said they hadn't got capacity, etc., etc. And it went to panel, and he did get an uplift. because we were limited to choice. And as David said, the local market rate meant that to get his needs met, that the direct payment rate had to go up, and it was honoured. And I thought that was a really good result from Somerset.
Thanks, Rachel. So we're coming towards the end. We've got a lot more questions, but we'll definitely respond to all the questions after the session. Some straightforward questions that were relative, I think might have been answered, but the resources will be freely available on TLAP's site. They are freely available now. They will stay that way, so you can access them directly on the website. We will be sharing this recording of the webinar on the website again, but also with people who couldn't make the session today, just to answer those couple of questions I saw pop up. Just one, and again, we did discuss this sort of subject as we were developing resources. We know that training for the workforce is one part of the improvement process. We also need leadership support, peer support, good systems that allow practitioners to practice, time to learn. How can we create those conditions for the resources to be implemented well? Does anybody want to take that on the panel? I guess my broad response to that is we absolutely recognise those issues. These are the sorts of pithy things, the sort of things we decided in the end we needed to do something foundationally to make sure there was consistent, good foundational information and advice practitioners. We recognise these issues. And I guess for me, we want to take these subjects and not ignore them, but recognise they do need work, and how we're going to work through those things together. We can do a series of webinars on these subjects. That's my broad response. But a panel, anybody in the panel want to respond? How do we create those conditions? We do discuss some of that in some of the reports. I think the Better Direct Payments report does discuss some of that. Tim, you were going to come in.
I was just going to say, really, in terms of, as I've been saying, in terms of Bristol, it needs to be part of our DNA in terms of the offer for direct payments needs to be having a conversation. So the resources need to be readily available. I think that was one of the key things I was recognising by creating these resources, Martin, was that I can't be on hand to resource or train every single day of every practitioner. I can do training, and I think it's still really important to have people in a room and face-to-face doing practical as well as shared experience, because we work in very much a hybrid kind of way now, with people often working remotely, not in office environments. And so that shared experience was one of the key things why I created the virtual cafe for people to meet every Wednesday. So I've had it today, and it's been very successful in people listening and learning as part of their main conversation, which people used to have. And so again, if they are working remotely, and this is where we are, this is the business as usual, then we've got to change the way that we inform and give guidance. It has to be really accessible as well as easy to find. And I think that's why creating these links and to the resources will be, again, my toolkit for delivering better direct payment training and program and building on that confidence. And I'm hoping I'm going to be able to measure that by doing some internal surveying on on practitioners to see about how it may be changing and their own confidence or their ability to have that open conversation. We'll be able to mark that and see where we've made a difference, and that will be absolutely really vital for me moving forward in the years ahead.
That's great, Tim. I think that's a good wrap up. Rachel, over to you.
Oh, yes, it was just to say there are two ways of doing this. There is going from services and the knowledge of services and implementation of direct payments, or raising the profile and the strength and the confidence of people like myself to ask for direct payments. And that, for me, starts in children's services as well. So if you have grown up with and have been having access to direct payments in children's services, then you will come through with more confidence to ask for one when you come through into adulthood. So I would say harness your user-led organizations, your peer groups, people who have had successfully used direct payments, and get us out there talking to people who draw on care and support to raise the profile that way.
Thank you, Rachel. So we're going to wrap up now. Thank you very much for attending this session and your input. I promise you we will respond to all the questions that we've got. I think some of the questions you've got will give us subject matter for us to think about and reflect as a group, and think about how we might continue these conversations through webinars, maybe some local events. Thank you very much. You can find the resources on our website now. You can see the links to the website there. You should have had those links. Well, I know they were being posted in the chat. So thank you very much. Anybody from the panel, a last word from the panel, or just a goodbye from the panel? Give us a wave. Thanks ever so much for joining us today.